Ambulance companies across the country have been heavily impacted by the pandemic. Truly at the breaking point. In a letter obtained exclusively by NBC News, the American Ambulance Association told the Department of Health and Human Services, the 911 emergency medical system throughout the United States is at a breaking point. Without additional relief, it seems likely to break even as we enter the third surge of the virus in the Midwest and the West. Joining us now, Chief Medical Officer at the American Medical Response, Dr. Ed Racht. Doctor, thank you so much for being on this morning. Can you describe the situation that the ambulance companies are facing?
Absolutely. Good morning, Mika. EMS, the ambulance services industry, through this entire pandemic, as the country knows, has been at the front of that front line. So the 911 calls, moving critically ill patients from one hospital to another, and that workforce has done a tremendous job. It's been done in a very challenging environment, and we are worried, we are more than worried, that the sustainability of that approach is in jeopardy.
And can you describe the scenarios that they are facing in terms of manpower, in terms of what they're seeing on the front lines, and why we are in this situation now today?
Yeah, it's an interesting collision. It's the perfect storm if you look at medicine and emergency health care. So you have an evolving pandemic, a critical infectious transmissible disease that spreads nationwide. It affects the providers themselves. So there is a tremendously enhanced protection mode, personal protective equipment, training, appropriately managing those folks. The call volumes in 911 in communities have skyrocketed given the number of patients. And given that environment, with the changes in all of the economics, not just nationwide in every sector, but particularly in healthcare, the storm that's created is a much tougher clinical environment, a much more challenging operational environment. Healthcare providers, paramedics and EMTs that are frankly getting ill, getting COVID, put themselves at risk with the challenges of obtaining increasingly costly PPE. And you put all that together, and especially at this point with increasing illness burden in communities and hospital saturation, the challenges are substantial. I think what's important is EMS can do this, and EMS has done this. But in order to sustain that effort, being able to finance that component, being able to support the providers, being able to look at regulatory relief to be able to manage communities in an unprecedented pandemic state is critical at this point. And we now know we're worried. EMS as a profession is worried about sustaining that as we move into an even tougher time in this pandemic.
Mike Barnacle.
Let's talk about that a little more, pull the string on that. With a crisis, as we're in, clearly, the calls double, triple every single day, it seems. Could you speak to the level of exhaustion among EMTs and the exhaustion factor leading to morale factors and just the general tenor of being an EMT out there every day, never getting a break during your work day, and what happens to you personally?
Yeah, first, Mike, thank you for the question. I think on behalf of my colleagues out there, they are exhausted. And in a profession that prides itself with being ready to take care of anything 24/7, 365, it is a tough change in their professional environment. And I think the exhaustion, the emotional fatigue, and the COVID fatigue, as we call it, coming to work every single day in new personal protective equipment, going home to our families who say, you know what, honey, I don't want you to infect the children, or, my parents are coming over. So the environment that's been created is one that the individual EMS provider, the paramedic, the EMT, is in the center of caring for critically ill patients, who are highly infectious, with challenging PPE, with an increased call volume, with their support system that's increasingly concerned that they will become ill and that they'll infect the family. So it creates a tremendous amount of emotional and mental stress. We don't want healthcare providers to have stress relating to their profession, to their job, as they take care of these critically ill and infectious patients. So it is a new level of fatigue and challenge for our colleagues.
Dr. Racht, it's Willie Geist. Thank you for being here this morning, and thank you for the work that you do and all EMTs do. The sounds of those ambulances back in March and April in this city in New York were haunting, but it also meant we knew that there were people like you out doing the job, and we're so grateful for that. What do you need to see at the federal level right now? We're having these discussions about another round of COVID relief. $908 billion is the number on the table right now. What are you looking for, and what difference would it make in the short term to get us through these next few months?
So I think the important factor, and Willie, thank you for the question. It's spot on. The important factor for sustainability is to be able to bridge the gap in funding, in finance for the EMS system until we get closer to whatever new normal is. So on the private ambulance side, the initial $300+ million was a start in April. That evaporated very quickly in the EMS world, given the demands out there. So as we push forward to be recognized as the front of that front line of healthcare, being able to manage those patients at the very beginning is what's crucial to sustain us as we move forward.
All right, Chief Medical Officer at American Medical Response, Dr. Ed Racht, thank you so much for being on. And coming up, we have a